Lack of affordability, lack of access, and a lack of mental health professionals. Another issue, some people simply do not know where to go for help. Social workers, psychologists, and psychiatrists are three very different professions who meet people when they are struggling. Social workers, according to licensed clinical social worker Dan Burns, are all about solutions.
Helping whoever that designated client or client group is, and doing so in a very solution focused way.
For example, you see a social worker and divulge that you're struggling with alcohol abuse. That person may connect you directly to a rehab facility or a group like Alcoholics Anonymous. Social workers also go far beyond working with individuals. They can be found working with families and organizations. And although it is a path less traveled, some social workers can provide therapy similar to the next profession we'll dive into, psychologists.
A psychologist, though, is going to definitely focus on the individual.
Dr. Sean Ward, a professor of psychology at Lemoyne, helped me to confirm that psychologists often use different forms of psychotherapy or talk therapy on individuals. Examples include cognitive behavioral therapy, or CBT, which focuses on the power of thoughts and changing those that adversely affect us, and DBT, or dialectical behavioral therapy, which is primarily suited for those who struggle with emotional lability or maladaptive emotional responses. In our example of an alcohol abuser, a psychologist would help the client work through the cognitive and emotional facets of their dependency. Now, these approaches only touch the surface of what a psychologist may use to make any one client a more well-adjusted individual, but what happens when talk therapy isn't enough? You may see a psychiatrist. As medical doctors, psychiatrists are the only ones allowed to prescribe meds in most states. In our example of the person who struggles with alcohol, a psychiatrist may be the person to prescribe them Antabuse, which is a common med used to treat alcoholism. Prescribing meds is something that they rely on heavily, which will make the therapeutic piece of the equation feel more superficial.
They tend to immediately prescribe, and that might mask or control some of the conditions. And again, you mentioned the shortage. Sometimes that's how they're managing the workload. They're just keeping people medicated and not really actually doing therapy.
The differences between the three professions are noticeable, but they all serve a critical role in maintaining the health and well-being of individuals, families, and society. For NCC News, I'm Laddie Springer.